I became committed to it quite early on, and over the years I've done this and done that, and I'm now the Secretary Treasurer of the British Fluoridation Society. That's really a sign of how committed I am to the issue. To kind of keep the issue on everybody else's agenda, because an issue that keeps fading in and out of focus, so to speak, and people can often think, oh, it's gone away, or it doesn't exist, or as the general public think, oh, it's all been done. But what's happened is that the government have now eventually said, look, this is ridiculous, and they've in a sense taken on the battle now. Yeah. Because it has been left to all of us, if you like, the NHS or supporters, to take the issue forward, local authorities. But now the legislation is saying basically the government are in favour of it, which they always have been, but officially in favour of it, and they're going to take the lead. So that's the big change, I think. Because the Health and Care Act 2022 is now been enacted, and in fact it's going forward now. The implementation is going forward, so that's why it's it's different, I think, this time, hopefully. Well, there are a number of layers here. There's a very straightforward layer that a lot of dental health professionals either don't know much about the issue, or maybe even a bit wary about approaching it, because it seems to be inhabited by people with strong opposition, very vocal people and so on. So they can be a bit reluctant to get engaged. All I can say is, and to coin a phrase which is rather a pun really, come on in, the water's fine. It's an issue which has been well researched, and there's plenty of good evidence now about that. They can bathe in the evidence to their heart's content, so to speak, or rest assured. There's plenty of support around if you want it, and the British Fluoridation Society, the British Dental Association, recognised organisations who are advocating this issue and can provide that sort of stuff. Publications like Dental Update, the British Dental Journal, and so on and so forth. Come on, do come in. The water's fine, and we'd welcome your support. But you don't have to become, you don't have to become evangelical about it. You just have to be able to reassure your patients, your staff, people you meet, that this is an issue that's worthy support.